Hey everyone, it's Dr. Mike here. Today we're diving into a topic that might make you think twice before your next kiss. Now, don't get me wrong, I'm a big fan of love and affection, but as a doctor, I also have to talk about the potential health risks associated with kissing. We often think of kissing as a harmless expression of affection, but did you know that it can actually transmit a variety of germs and viruses? That's right, your mouth is home to millions of bacteria, and when you lock lips with someone, you're essentially swapping spit and all those little microorganisms. In this video, we'll be exploring some of the common and not so common infections that can be spread through kissing. Don't worry, I'm not trying to scare you off from kissing forever. My goal is to educate you so you can make informed decisions about your health and well-being. Let's start with one of the most well-known culprits, the herpes simplex virus, or HSV. There are two main types, HSV-1, which typically causes oral herpes, cold sores, and HSV-2, which is more commonly associated with genital herpes. However, both types can infect the mouth or genitals through oral sex. Now, here's the thing about HSV. Many people have it and don't even know it. That's because it can lie dormant in your body for years without causing any symptoms. However, when active, HSV can cause painful blisters or sores around the mouth or genitals. The tricky part is that HSV is most contagious when these sores are present, but here's the catch. It can also be spread even when there are no visible sores. That's why it's crucial to be aware of your own HSV status and to talk to your partner about theirs. Next up, we have Streptococcus, a type of bacteria that's probably best known for causing strep throat. But did you know that strep bacteria can also hang out in your mouth and be spread through saliva? That's right, a simple kiss can transmit these bacteria, potentially leading to strep throat or other infections. Now, most of the time our immune systems do a pretty good job of fighting off strep bacteria, but sometimes these bacteria can get the upper hand, especially if someone has a weakened immune system or is already fighting off another infection. Symptoms of strep throat can include a sore throat, fever, swollen glands, and white patches on the tonsils. If you suspect you might have strep throat, it's important to see a doctor to get tested and treated with antibiotics if necessary. Now, let's talk about a virus you may not have heard of before, cytomegalovirus, or CMV. CMV is actually quite common. More than half of adults in the United States have been infected with CMV by age 40. The good news is that for most healthy adults, CMV doesn't cause any noticeable symptoms. However, it can cause serious health problems for newborns who are infected with CMV at birth, as well as for people with weakened immune systems. CMV can be spread through bodily fluids, including saliva, urine, blood, and breast milk. That means kissing, especially if someone has an active CMV infection, can transmit the virus. You might associate hand, foot, and mouth disease with daycare centers and playgrounds, but this contagious viral infection isn't just for kids. It's caused by a group of viruses called enteroviruses, and it can be spread through saliva, nasal secretions, and blister fluid. As the name suggests, hand, foot, and mouth disease typically causes sores in the mouth, on the hands, and on the feet. It can also cause fever, sore throat, and loss of appetite. While it's usually mild and goes away on its own within a week or so, it can be uncomfortable. The best way to prevent the spread of hand, foot, and mouth disease is to practice good hygiene, like washing your hands frequently and avoiding close contact with people who are infected. Finally, let's talk about Epstein-Barr virus, or EBV. EBV is so commonly spread through saliva that it's often called the kissing disease. It's a type of herpes virus that causes infectious mononucleosis, or mono. Symptoms of mono can include fatigue, sore throat, fever, swollen lymph nodes, and a rash. It can take weeks or even months to fully recover from mono, and there's no specific treatment for the virus itself. Like other viruses we've discussed, EBV can be spread even when someone doesn't have any symptoms. So it's important to be mindful of your own health and to avoid close contact with others if you're feeling under the weather. So there you have it, folks. Kissing might be a sweet gesture, but it's important to be aware of the risks. Remember, knowledge is power when it comes to your health. The best way to protect yourself from these infections is to practice good hygiene, like washing your hands frequently, avoiding close contact with people who are sick, and being mindful of your own health. And of course, open and honest communication with your partner about your health history is crucial. Stay informed and stay healthy. Don't forget to like, comment, and subscribe for more health tips.